Are you leaking urine all over yourself, worried you smell like a nursing home, resorted to wearing diapers again, and you even have a vaginal bulge? Well, you can have your leaking and your prolapse solved. Watch this video. You'd need my help. I am Jeff McQueary, a Tennessee urogynecologist. If your prolapse and incontinence problems are dominating your life, take back control by solving your problems with solutions from my channel, Women's Healthcare Answers. So what are we talking about? Well, urinary leakage is often caused by pelvic and bladder prolapse. So when the bladder falls, and this can be because the bladder, uterus, or upper vagina is falling, you can have a kink near your urethra. This can obstruct the flow of your urine and can lead to difficulty in completely emptying your bladder. And because of this kinking, the different types of urinary issues caused by prolapse are urgency, urge leading to incontinence, stress incontinence, and overflow incontinence. About 80% of the time when you have prolapse, you will have some sort of urinary difficulty which could lead to one of these forms of incontinence. So stay till the end so you can understand the causes of incontinence with prolapse and the treatments best for you. So what are the symptoms of these various types of incontinence? Well, the symptoms are very difficult to deal with, but often I have patients who come to the office with the inability to make it to the bathroom in time. I have patients that tell me they are sitting and watching TV or doing other activities, and when they go to get up, they can't make it, leaking all the way to the bathroom. And you know where this leads? To wearing liners or Depends diapers. No one wants to do this, but you often have to resort to it. And these symptoms define urge incontinence. Another symptom I often hear is just spontaneous leakage without even feeling like they have to go. The urine literally just pours out. And this can be overflow incontinence, where it's like if you're not watching and you overfill a pan of water in the sink. The bladder can be so full, it just literally overflows out. But another symptom is leaking with coughing and sneezing, lifting, bending, and even sex. These are the symptoms of stress incontinence. You may also get multiple bladder infections, and this is caused by retaining urine and bacteria in your bladder and not completely emptying. This can become such a severe problem that it leads to difficult to treat bacteria and even kidney infections and sepsis, landing you in the hospital. So if you have any of these symptoms and you know you have a vaginal bulge, then any of these types of incontinence could be your problem, and it's caused by the prolapse. So what are the causes of incontinence in this prolapse? Well, the strong tissues of the vaginal wall, including ligaments and muscles, are very significant in holding back the vagina and the bladder. They typically do a very good job. But if they fail, tears in these tissues and ligaments, as well as weakening of the muscles with advancing age and menopause, can lead to these problems. But other factors are having one or more vaginal deliveries of your children, and in addition, a forceps vaginal delivery can even cause more damage to the pelvis and is often not seen at the time of your delivery and is often difficult to repair anyway. But the only causes of incontinence that you can really change are obesity and chronic constipation. So do whatever you can to try to lose weight. Even a 10% weight loss can help. And treat constipation with fiber or Miralax so you don't have to strain as much and cause any more damage to your pelvis. So what are the treatments? Well, the first thing to potentially try to help with prolapse leading to incontinence is a pessary. This may be something you don't want to keep forever, but even temporarily it can help. And I've talked about pessaries in other videos. Another non-surgical approach is pelvic floor therapy, and this certainly can help strengthen muscles, but it will not fix broken tissues or ligaments. So if you like this video so far, hit the like button. It really helps with YouTube, and please subscribe, because if you miss any of my videos, who am I going to talk to? Give me a thumbs up and please comment, because I want to help answer your questions. Well, so the surgical treatments include fixing the prolapse and then addressing the incontinence at the same time. I have other videos on these subjects that really can help you, so check out my YouTube channel, Women's Healthcare Answers. One of the things we do see is that if you have your prolapse repaired, often this can uncover stress incontinence that was already there because it was weakness already there. So it is important for your gynecologist or urogynecologist to reduce or push back in your prolapse in the office to see if you leak. If you do, then leaking can be fixed at the same time as the prolapse repair. This is the main reason you need an experienced doctor who can uncover and fix all these issues. Also, it is very common to have more urgency and leaking after a prolapse repair, and often this can be treated with medications. So don't be frustrated, just ask your doctor for treatment. Talk with your gynecologist, they can choose the right treatment for you, or send you to a urogynecologist or pelvic trained urologist who should be able to address these problems for you. So my main point to understand is urinary leakage of all types, whether it be stress, urge, or overflow incontinence, can be the result of your vaginal prolapse. The solution can be as easy as a pessary, physical therapy, or medications. But don't be afraid of surgery that can repair all these problems in one procedure. Make sure you watch my other videos on urgency incontinence and pelvic prolapse, and that will be linked to the end of this video. They will teach you more about the specific treatments for these difficult life problems. Just please don't suffer in silence. Seeking medical advice for these issues may allow you to get your life back.